Hi everyone, and a warm welcome to another episode of the Talk Room series of podcasts, where we look at the question of how to be your best self. We do that by looking at a question of mental health and well-being. For those people that haven't seen any of our previous podcasts, I'd like to introduce my co-presenter, Ian. For those that don't know Ian, he's an accredited counsellor with the British Association of Counsellors and Psychotherapists, and also the founder of Hope Therapy and Counselling Services, which is a counselling practice that operates throughout the south of England. And it offers mental health services both to organisations and also private individuals.
Thank you, Wendy. And similarly, to introduce you, you're a highly experienced CBT psychotherapist who's been working in private practice in the field of mental health more generally for well over 30 years. So thank you so much for being here again.
And thank you, Ian, too. So, Ian, I know that employee mental health is an area that is really dear to your own heart and something you feel very passionately about. Would you mind sharing a little bit more about your background and how that has informed your view about the importance of employee mental health?
Yeah, so thank you, Wendy. So for 25 years, I worked in senior management, in directorial positions. I worked in FTSE 100, FTSE 250 organisations where I managed large teams of people. My last role, I was managing about 200 staff. And one of the largest challenges that we had was finding a way of trying to reach a sense of balance between the needs of individual staff that were struggling with a variety of mental health challenges, alongside the wider needs of the business, which were often very much focused on productivity, profit levels. I've also worked with lots of really small businesses, and what my experience has shown is that whether it's a large or a small company, they both struggle with many of the same issues, that constant drive to perform, to be productive, to generate cash for the business, while needing to also balance that against the needs of the individual employee who may be struggling with a variety of mental health and well-being challenges.
Yes, I can imagine that might be quite a challenge. Businesses today are being placed under more and more pressure to deliver more and more profit to satisfy shareholders. I can imagine the temptation can be to put pressure on individual staff to perform. But that isn't necessarily always helpful if somebody is already really struggling with their own mental health challenges.
Yeah, I mean, that's entirely right. So the risk is that if people that are already struggling with mental health challenges are pushed too hard, they may get to a point where they simply go off sick, or they leave the business altogether. From an employee perspective, they may feel that they have no choice because they can't function in what they seem to be an increasingly stressful environment. And from an employer's perspective, who may be very focused on productivity, that's the worst possible solution. Once someone is off sick, apart from the very real human cost, the employer, from a productivity perspective, then has absolutely zero contribution being made. And if the employee actually leaves, then all of that experience is lost from the company for good. You then also get all of the additional cost of having to recruit somebody, to train them, and to hope that the new person is the right fit for the business and will stay and be productive.
Absolutely. So not only supporting employee mental health and staff going off sick, it seems like a lose-lose for both the employee and the employer.
Well, and that's right. So what teams like Hope Therapy and Counselling do, and I know you do as well, Wendy, is work with people that may be struggling with mental health challenges so that they can hopefully stay in the workplace, or if they're already gone off sick, we work with them so they feel able to rejoin the workplace as soon as they're able to. That way we can hopefully change a lose-lose situation into a win-win situation. So for me, I strongly believe that one of the most important things that we can that we need to do as business leaders is to create an environment where all staff can thrive, and that means to recognize the needs of everyone, including those that are struggling at any given point.
Yeah, Ian, that is so interesting. And I totally agree with what you're saying. But I'm just curious to know how much of an issue you think this really is.
Well, a company's staff are their most important asset. And as I said earlier, I manage large teams for 25 years in huge FTSE 100, FTSE 250 businesses before setting up Hope. So for me, I saw staff leave far too often simply because they didn't feel their well-being needs were being supported in the way they wanted and needed. Mm-hmm. Nowadays, staff see effective mental health and well-being plans as being a right, an entitlement, not just a wish. And if those things aren't in place, understandably, they can be quick to talk. They talk to other staff members, they talk to potential staff members. And websites like Glassdoor, for example, as well as social media, means that dissatisfaction can have a really wide-reaching effect that can be hugely costly to businesses. So both from a staff retention and staff attraction perspective, being able to support staff welfare needs to be seen as being absolutely essential nowadays. And many organisations, especially more progressive organisations, really understand that need, seeing the return on investment of supporting staff mental health in terms of improved productivity, keeping sickness levels lower, as well as simply doing what they see as being the right thing. Mm-hmm. But in terms of prevalence, well, we're told that 1 in 4 people will struggle with mental health issues. So that's a quarter of your staff are likely to struggle with a condition that would be impacting them in some way in the workplace. Even if they don't get signed off or leave the business, it's still going to be impacting them. In terms of people that get as far as being actually absent from work, well, the Health and Safety Executive told us that in 2020, 2021, stress, depression, or anxiety accounted for something like 17 million lost employment days per year. So that was nearly 3% of people actually got as far as being signed off at some point due to mental health, with 51% of long-term sickness being attributable to stress, depression, or anxiety. These are huge, huge numbers. And we're also seeing increases in mental health self-reported absence in the workplace. We're not seeing a decrease. So these are issues that are already having a significant impact on employees and therefore employers, as well as the overall economy. So it's essential, both from the perspective of staff, but also companies themselves, that these are issues that are being actively and proactively managed.
Yes, I mean those figures are astonishing, Ian. They really are, and the way you've explained it all makes such sense as well. But I'm curious to know why you think that these organisations aren't addressing these issues.
Well, the starting point is to say that many more progressive companies already are. As I said earlier, some companies are very much focused on these things and are really reaping the rewards of doing so. They see it as part of their retention and attraction policy, part of their productivity strategy, as well as simply doing what they see as being the right thing. You then get companies that are working really hard to try to address those issues, but for whatever reason may not be quite there yet. They may have HR teams who are working really incredibly hard at doing the very best they can. But we have to remember, HR professionals are usually incredibly busy people. So the amount of time they can give to supporting any one individual may not always be as much as they would like. Also, again, we have to remember that HR professionals and managers more generally aren't trained therapists. So they often don't have the time, and in many cases aren't qualified to meet the more acute needs that can often accompany mental health challenges in the workplace. And then, of course, you get the category of company who may have less experienced managers in place. They often are very focused on productivity, they're very focused on hitting targets, but may not have always learned that the best way to hit those targets is to have a full workforce with motivated and engaged staff who feel supported by their employers. So really, there can be lots of reasons, but that's where organisations like Hope, and of course you too, Wendy, play such an incredibly vital role. People that are able to support staff and companies in dynamic and highly focused ways, bringing years of very specialist training without distracting existing staff from the work they're already doing.
Okay, Ian, thank you for that. Well, that all makes complete sense to me. So can you talk a little bit more about what sort of things do people reach out for when they're looking for mental health support?
Yeah, of course. So mental health challenges can come in various different forms, but the most common things that people tend to present with in the workplace are usually things like stress-related disorders, anxiety, and depression. It can be many other things as well, though, but those are often right at the top of the list. But people might also really struggle with a variety of things that they may not necessarily recognize as being a mental health challenge, or simply that it hasn't yet got to a point where it would be identified as such. So we might see things such as imposter syndrome, where people simply think that they're not good enough in their role. And that can be true of the chief executive right the way through to somebody that's a completely new entrance into the business. People may get hugely anxious if they have to do specific things such as public speaking or a presentation or dealing with a difficult customer or difficult colleague. And a counsellor may work with any of those things and so many more things besides. So our mental health challenge may also be something that's constantly there, something that literally never goes away, or it may be something that simply kicks in at certain times when we have to do certain things or certain tasks or certain activities. And it's really important for us to recognize that mental health challenges can affect absolutely anybody, men or women, people of any colour, of any religion, of any age, and absolutely any educational background. There was a study done recently by the University of California, which showed that 72% of entrepreneurs surveyed expressed concerns around mental health, 72%, with 49% reporting that they had one or more lifetime mental health challenges. Overall, entrepreneurs were 30% more likely to experience depression than members of the general population. And you've got people like Aaron Swartz, for example, who's the co-founder of Reddit. He's talked very openly with his battle for depression. Elon Musk, who's seen by millions as being the epitome of entrepreneurial success, yet he's talked about terrible lows and unrelented stress that he's felt. In fact, Bupa Global, their research suggests that 64% of senior business leaders have suffered from mental health conditions such as stress and depression. So whatever size of organization that you have, and whatever structure exists, and whatever level you're at, the way we recognize and support mental health in the workplace can have a huge effect, both for the individual and for the organization itself.
Thank you, Ian. That's a really fascinating insight of the sort of mental health related challenges both companies and employees may face, and a good overview of the type of support that's available. So if you want people to know more, what should people be doing?
Yeah, so Hope, and I know you too, Wendy, offer support in a variety of different ways. One of the things that we pride, and I know you pride yourself on, is being able to respond in a really dynamic and flexible way. So companies might want provision to be put in place to support an entire organisation, whereas others may just be looking for one particular individual who has a need in that moment. Some organisations may choose to offer open-ended support, whereas others may offer support for a fixed number of counselling or therapy sessions. But one of the things that organisations like Hope and yourself is able to do is to act quickly. And when you consider that the waiting list for mental health support via the NHS can, in many cases, be months, we can respond within days, helping companies support their most important asset, the employee, and therefore the company itself to be able to thrive.
Okay, that's really good. Thank you so much, Ian. And can you tell me a little bit more about how we can get in touch with you if we want any more information?
Well, Hope has a team that operate throughout England. We work both with private clients, but also we have worked with county councils and charities and companies of various different sizes. So people are really, really welcome to get in touch with us. And we can discuss the type of support that is available and most suited to their specific needs. We can discuss the wider needs of the organisation or the individual client. And to do that, people just need to go to our website, which is www.hopefulminds.co.uk. There's a tab called Organisations, which tells people all about us, then the type of support that we're able to offer. But of course, you too, Wendy, you offer support to people that are struggling with a whole variety of mental health challenges that affect them in the workplace. So why don't you just take a moment to talk to people about the type of support that you offer as well?
Yes, Ian, I can relate totally to everything you said today and how important it is to support the individual person with their own mental health needs and to support them quickly. So I too provide individual therapy to organisations, and if they want any more information they can go to my website wendyc.team and they can contact me there. So Ian, thank you so very much for your wonderful overview of mental health in the workplace and how important it is. It's a huge subject, and thank you so much for touching that subject today. And I want to say a great thank you to all the people who've been listening today, and I hope you can listen to previous podcasts that we've done and stay in touch because we've got more podcasts to come. So thank you for me, and would you like to just say a goodbye as well, Ian?
And a thank you from me as well.
Okay, take good care. Bye-bye.
Best care to everyone.